A patient's a patient. It doesn't follow a textbook ever, not one time. My name's Rene Sprague. I've been a nurse or in some capacity at USA Health Children's and Women's for the past 20 years. About 3 years ago, I started a program called the Bridge Program. It began in an effort to follow lethal fetal diagnosis, and it was to educate the parents, provide support, come up with care plans. The goal being that they made educated decisions for their babies and decisions they were at peace with. So because I have a special needs child, that was my first child that we adopted, I had a very long journey kind of coming to terms with his diagnosis, multiple diagnosis, and the care that it was going to require and the life-changing experience that it was. So I think because of that, I'm able to walk into a newly diagnosed family and kind of see where they are. I'm able to read that room pretty quickly to see if we're angry, if we're sad, if we're unbelieving, and I just kind of meet them there instead of pushing them into the direction that we feel they need to go. I think that we aren't noticed a lot of times nationwide for what we're doing because we are a smaller hospital system, but man, with the resources we have, we are just knocking it out of the park in multiple areas, and it's consistent, and it's the staff. You don't have to be a physician to make a difference, and the physicians support that. Just working at a teaching hospital in general is the reason I'm able to have a program, because that's what you do in a teaching hospital. Like, nobody has concrete ideas, and that's what we stick with. It's very fluid because medicine changes, and a patient's a patient. It doesn't follow a textbook ever, not one time. I think the goal of any teaching hospital should be to share what you learn, not to hold on to the information for yourself. And we're working really hard, especially through this program, to make that happen. We see things differently, and that's how we transform medicine.